And I'm sure you're getting tons of questions about COVID-19 and children. One of the questions that we've been getting the most, basically, how children can transmit this virus, or do children transmit this virus?
Right.
What have you been learning about that?
Yeah, the virus is transmitted through same very similar fashions as you would think of the flu being transmitted. It's we think with a droplet transmission. There have been some concerns initially of some scientists saying whether it's airborne, which is a lot more contagious from that standard. As of right now, from the CDC and the World Health Organization, we think of it as more like a droplet, meaning if you sneeze on somebody, some secretions from somebody from their breath gets on you, or contact on a surface that you touch that, and then touch your hands by your mouth or nose or your eyes, then that's the easiest way to transmit it. In terms of children, again, similar manners in terms of them transmitting from one to the other, especially in younger kids. We know that they don't like to wash their hands, and they may be too close to each other. So, in a similar fashion, those droplets may be transmitted from one child to the other. So, those are the main ways of transmission that we know of at this time.
Are you seeing that in some cases, there are households where all the children will get sick, but the adults won't, or vice versa? All the adults will get sick and the kids won't. I mean, we have seen very different scenarios here where that's happened.
Yeah, that's tough. It's tough to say what's the true infection rate of family members. Typically, and again, the data's still not clear on this. We think it's more the adults passing it, or the adults slash adolescents passing it on to the younger children, instead of the other way around. But again, the data is not 100% clear on that. We do see certain members of the House that might have a positive test where others have a negative test. And the one thing I always want to make sure that families understand is that the test is not 100% perfect, especially depending on the type of test that's done, how it's done, affects the quality of the test. So even on the best test done, this what we call the sensitivity of the ability to pick up whether you have it or not, can be between, and these are the best tests, between 80 and 90%. So still not 100%. So that might be a reason that you might get a positive in one member and a negative in another member. But in regards, and then you also have those folks that are asymptomatic. Plenty of folks that might have the infection but don't have any symptoms. So it's always tough to say. We just assume once we get a positive in the household that everybody's positive. And those are the quarantine rules that we tell families. Once somebody in the house is positive, everybody in the house is quarantined.
Are you seeing that children who are showing symptoms and are testing positive for COVID-19 are having a lot more mild symptoms than in other cases with adults?
Yes, thankfully so. And most of the kids, again, are doing incredibly well. And most of the kids don't need to be admitted to the hospital in regards to that. And even those that are admitted to the hospital, we tend to see them do very well and leave within a day or two. The children that we do see having more complications, if we do have children that have comorbid conditions, or if they have obesity, especially in the adolescents, they tend to have a little bit higher risk of longer hospitalizations. Thankfully, they've all done well from the ones we've seen here. But again, their hospitalization, if they need to be hospitalized, might be a little bit longer.
Doctor, are you also seeing that if the risk is higher with those who, for instance, babies who have had RSV, or children with asthma or allergies, have you seen that the risk is higher in those kids?
A little bit, but not much. Not much, as just like any other infection that we see. If somebody has the flu and they have asthma, they are at higher risk, but not any different than with coronavirus. So they are at higher risk of just having general illness, but we haven't seen that pan out in terms of having more serious complications.
What about symptoms that are unusual for COVID-19? We have heard from parents lately. For instance, we just did a story with a family yesterday that the child was positive for COVID-19 and started to develop issues with his appendix. Whether or not it was related, the doctor couldn't say for sure. But,
Sure.
that, and we've also heard UTIs. A lot of kids have been coming in with UTIs to the ER and then test positive for COVID. Is that
Yeah.
something you're seeing?
Yeah, we're not exactly sure if they're related or just happen to be coincidence. Like I said prior, there's a lot of asymptomatic infections. So you might be asymptomatic from COVID and then have something else pop up, which normally happens in children. So we're still trying to see where the data lies out on that. As of right now, we definitely see some kids even more what we call a perforated appendix. A lot of folks are scared to come in, and they kind of hold on to the symptoms at home, and then the appendix bursts, unfortunately. We still treat them, and obviously, and they do well, but they require a little bit longer hospitalization from that. So we are trying to tease out the data and seeing if the COVID is related directly or just happens to be coincidental in regards to the infection.
Any other issues that you have kids coming into the hospital for and then
Yeah,
test positive for COVID?
yeah. I mean, the whole gamut of things. We do have we screen all of our what we call our pre-op patients. So any child that's going to require a scheduled operation, they come in and we do a COVID screen on them. And again, 99.9% of them are asymptomatic, and we have seen positives in those children. So again, it's indicative to us that there's many asymptomatic folks out there that have the infection. And in regards to other symptoms that we don't count, we always talk about the respiratory congestion, cough, but we are seeing some with abdominal pain, some gastrointestinal type symptoms, vomiting, diarrhea, which aren't the more common ones we talk about, but we definitely do see it associated with the COVID infection.
Any other complications that you're seeing aside from the multi-system inflammatory syndrome that I know has affected some kids that have had COVID?
Yeah, there's some reports out there just in terms of neurologic symptoms, altered mental status that could be related to the COVID infection. Again, there's not much information out there, but there are reports of that occurring, like what we call an encephalitis type picture, where they have fevers, altered mental status. They might have some swelling within the brain, and causes them to not be acting like as they normally should. Again, we think it's related to COVID, but there hasn't been direct evidence that's for sure.
But these are all rare occurrences.
Very rare, as is the multi-system inflammatory syndrome. Even though that's gotten a lot of press, it's also like to assure parents that even if you have a COVID infection, the chances of a child getting that is also very rare.
Are you seeing that more kids are getting that even though it is rare, or have you seen a pretty low number since we learned about this?
Yeah, we saw a bump initially when the information was starting to come out, and I believe, in my personal opinion, was after we had the first bump in infections. Then we saw this about 3 to 4 weeks after. Now that we're seeing this another bump coming up with children, my prediction is in 2 to 3 weeks we may see more of that. So anytime we have a parent that has a COVID infection, again, assure them that 99.9% of the time we're not going to see any further issues once they get over the infection, but to watch for the symptoms of the multi-system inflammatory syndrome, which is the rash, the fever coming back, redness of the eyes, swelling of the hands and feet, redness of the mouth, of the lips and tongue. Those are the type of things we tell them to just to watch out for and just be cognizant of it. But again, the chances of it happening are incredibly rare.
The statewide statistics that we're seeing on the positivity rate for children, I think it was at 33% this week, 1 in 3 children testing positive. Are you guys seeing that as well in your hospital, the kids that come in and get tested?
It's remarkably close, and since June 24th, we just ran our data. Our positivity rate is about 31%. And again, those are children that are a combination of screening that we do for those patients that are having operations and kids that are coming in with symptoms. So it's a combination of both that we're having. So yeah, it's matching what we see across the state.
Anything that you can tell parents as far as what they should be on the lookout for? Because I know in a lot of cases, parents are only looking for those respiratory symptoms, or fever, coughing, but that not may not always be what presents itself in COVID at first.
Sure, yeah, and again, it's always I always tell parents, listen to your sixth sense. If you see something's off with your child, there one of the symptoms, especially in the adolescents, we see that lack of smell or taste as one of the first presenting signs, or if they're just excessively tired compared to what they normally are. So those are the ones that are a little bit not as common, but something that should be a red flag once you see that. And again, most of the times they're not going to require any sort of medical attention, but if noticing that there is that difficulty breathing, that they're not eating or drinking and getting dehydrated, and at that point, I'd recommend obviously reaching out to your pediatrician and then seeking medical attention.
Are you seeing that parents are a little bit hesitant to take their kids to the ER these days?
It's been a little bit less than at first when this all came out. I think folks are realizing that they shouldn't wait as long. And as I mentioned before, with the perforated appendix, I did see that early on because folks were scared. But at this point, we've, especially here at Nicklaus Children's, provided a safe environment. I always tell folks it's probably one of the safer places to be just because of all the precautions we take and the regulations that we have on any visitors wearing masks, the distancing, and making sure there's multiple areas where you can wash your hands. So we're providing as safe of an environment for the families in order for them to feel comfortable in terms of coming here. But in general, that anxiety is normal in terms of being scared to go outside the house. And even if they need to seek medical attention, that's why I always say communication with your pediatrician is key. And always we have our hotline here for parents. If they need to go to our website, our hotline is readily available there and they can always call with questions.
Doctor, we've gotten a lot of questions from parents about sending their kids back to school, and obviously that decision is different for every parent depending on their situation. Can
Right.
you say from a medical standpoint, like what the risks might be of having a child around other people in school?
Sure, that's a great question, and the answer is always going to depend on what the rate of infection is in that area. The American Academy of Pediatrics made some strong recommendations about encouraging the return to school just because of all the other positive things that we see with the school environment, especially not just from an academic standpoint, but from a social aspect and the importance of that. But at that being said, it has to, if there's the ability within the school to do appropriate social distancing, to that the child is capable of keeping a mask on and making sure that the staff is ready and has a plan to, if there happens to be a positive case, what would that plan be? So I think a parent should be asking a lot of questions at this point, and the schools need to be prepared to answer those questions. And again, like you said, it's going to be individualized in certain cases. If there's a child that has a higher risk, has a chronic condition, is immunosuppressed, that child obviously would be probably better fit at being doing the learning from home, or at least at the very most a hybrid model. But again, it's going to be individualized to everybody's community and to everybody's personal situation.
Absolutely. Anything else you'd like to add? I know there are a lot of unknowns right now on how COVID-19 affects children in the long term, and there's been a lot of questions surrounding that. I mean, is there still research going on what
Yeah,
exactly that
yeah, and
impact is?
we're going to continue to learn new information every day, and that's what since this started at the beginning of the year, there's been more than enough articles to keep up with in terms of the medical literature. The one thing I do want to assure parents of is to take the appropriate precautions, mask, washing your hands, and the social distancing, and making sure that the children are aware of it, but also to talk to the children about it and not to create fear, but to also make it realistic. And again, even if they were to get infected, they very likely that they do very well with the infection, they get over it. But at the same time, be respectful of it and not to toss it aside and say it's not a big deal. Because as we all know in South Florida, we have many multi-generational families within a home. So especially for those adolescents, I do recommend having that conversation with them. It's not all about them because they're probably going to do fine, but it's for those around them and to be a good steward in your community.
Well, and there was a doctor yesterday who we spoke with over at Palm Beach Children's Hospital who brought up an interesting point that I hadn't even thought about. We haven't really seen how this virus plays out among children because they've been isolated for a few months, right? So they haven't even been back in a school environment.
Yeah, and in all honesty, we've seen not just decrease in hospitalizations, we've seen decrease across all infections, just because they're not around each other spreading infection, which is a good thing. But the other thing is that we all know the importance of social interactions, and for the children, we do see increase in some psychiatric illnesses, anxiety, depression, just because their patients are isolated and they can't interact with others. So it's a fine balance.
Absolutely. And the benefit to their immune systems too to be around those other germs.
Exactly right. And that's something that, again, we don't know all the details of at this point. But again, when we make the decisions, those all have to be taken into consideration and making sure that, number one, we provide a safe environment. Number two, realize all the other benefits that we can get from the social interactions. But again, we need to do it safely.